LeMaitre's journey of innovative vascular solutions started over 40 years ago when Dr. George LeMaitre invented his first valvulotome. Not only was Dr. LeMaitre a vascular surgeon, he was also a problem solver, including the number of limb amputations that he felt could be avoided. He set out to find a new solution to save limbs that left the vein in place and didn't require direct vision. Since his first fixed-diameter valvulotome design in 1983, Dr. LeMaitre's small one-man operation has grown into a publicly traded company saving limbs all over the world. Dr. Johnston has been using the valvulotome for years and appreciates LeMaitre's commitment to consistent improvement. The LeMaitre Valvulotome is full of features that make for well-positioned, clean valve cutting, decreased wound necrosis, and faster patient recovery. For one, it's self-sizing, from 1.5 millimeters to 6 millimeters, and has self-centering hoops. So he can use one device to cut valves in both small and large diameter veins. The hydrophilic coating not only allows for easier insertion, but it also enhances trackability to minimize potential for intimal interaction. Additionally, the depth markings and green safety stripes also help approximate location and position. And today he's facilitating a live, minimally invasive in situ bypass training session for chronic limb-threatening ischemia. Dr. Fielding is one of the surgeons sitting in on the demonstration. He's been trained on reverse bypass, has been performing it for years, and is very comfortable with it. Dr. Johnston understands this perspective. He too spent time performing reverse bypass but finds the valvulotome to be less invasive and more efficient. Think of it like this. If a truck spills its load and blocks an expressway, the traffic must be rerouted. If there's a one-way bridge nearby, what's the easiest solution? While construction crews could disconnect the bridge, pick it up, and turn it around, that would be a massive amount of work and most likely damage the structure. It's more efficient to change the direction of the traffic. The LeMaitre Valvulotome allows you to change the direction of blood flow while leaving the vein in place. Another attendee, Dr. Moreno, primarily uses traditional endovascular procedures. Dr. Johnston says that it's not just his personal preference to use the LeMaitre Valvulotome over balloon angioplasties and stents. The LeMaitre Valvulotome makes Dr. Johnston's procedures more efficient and is better for patients. How do we know? An international randomized trial from 2022 showed that for patients with chronic limb-threatening ischemia, in situ surgical intervention had improved outcomes over endovascular therapy. Patients in the surgical group had a lower incidence rate of new or recurrent CLTI events than those in the endovascular group. Furthermore, surgical intervention had a lower percentage of major reinterventions, such as above-ankle amputations. While 9.2% of the surgical group needed a major reintervention, the endovascular group had a rate of 23.5%. The paper's authors saw a compelling primary role for initial surgical revascularization in the treatment of CLTI. Dr. Fielding and Dr. Moreno both decide to give the LeMaitre Valvulotome a try. Building upon new innovations, LeMaitre will continue to push the boundaries for improved vascular health with a portfolio of vascular products. Register for a live in situ bypass demonstration and see how you can give your CLTI patients better outcomes with LeMaitre's self-sizing, self-centering Valvulotome.